Welcome back. It's time for morning rounds this morning. Christie Clinic is preparing to reschedule hundreds of elective procedures that have been on hold since this pandemic started. Well, here on video chat to tell us more about the reopening is Christie Clinic's Chief Medical Officer, Dr. Bill Pierce. Good morning, Dr. Pierce. How you doing?
Good morning, Christy. Great. Thanks for having us.
Thanks for being here. So first and foremost, we have to talk about what an elective procedure is.
Right. There are two types of procedures. One is elective, one is emergency. And as you stated, we stopped all of elective procedures considered non-essential about 7 weeks ago. So we've got about almost 700 cases that we had to cancel.
So what are some of those things that people might now be able to start rescheduling?
Sure. A lot of different procedures that we now want to start doing, things like gallbladder surgery that needs to be done, colonoscopies, joint procedures, things that people have been able to put off without too much harm, but we want to start to get those back in and start taking care of those for the patients.
What are some of the requirements that you guys have had to get this back running up again?
Sure. First thing we want to do is look at safety. We want to make sure that the staff is safe as long as and also the patient. And so we make sure that we have enough PPE to make sure we're doing things correctly and is fitting correctly. Also, patients will get a COVID test and they will get that 72 hours before the procedure. And it has to be negative to have the elective procedure done. And once they get the test done, then they will quarantine themselves in their home prior to surgery. And as they do come into surgery, then we'll check them for a temperature and other things like that.
So, Dr. Pierce, this is still going to be a process even though you are starting the scheduling process?
Yes, this is a process. We are contacting patients that have been canceled and getting them scheduled. We prioritized it based on the American College of Surgeons tool to take a look at the priorities, and we want to make sure that they're ready to go, that their histories and physicals have been updated, lab work is updated, and they're being scheduled right now.
And we mentioned that there have been hundreds that needed to be rescheduled that were postponed. I mean, how many are we talking now?
Yeah, Christie Clinic has about 700 patients that we've canceled, and 350 of those are considered high priority. So we're putting those patients first and following, again, the American College of Surgery guidelines to prioritize those patients.
And of course, you mentioned that these are elective procedures, but this is still scary for those patients who might have needed a procedure done, and then all of a sudden, no, wait, you can't. So why is this so important to get them back in?
Well, most of the time patients are having pain, and we've looked throughout the entire time of this crisis to make sure that we're taking care of those patients that need surgery. So in constant dialogue with surgeons, we've taken some people to surgery that need it. But now the surgery is open. We're going to be able to do it safe. So we're going to be able to take care of those patients that are having pain or need joints replaced that are causing them limited mobility.
And now, should patients who maybe think that they are on this list be contacting you, or do you think that your people there at Christie Clinic will be contacting the patients in order of priority?
Yeah, sort of both, Christy. We have reached out to all of the patients that we've canceled and gotten them scheduled. If they feel that they need to get scheduled, certainly call in through the My Christie portal or call the physician office.
I'm sure this is a big relief for a lot of those patients out there right now. Dr. Pierce, thank you so much for your time this morning.
Thank you, Christy.